AM 1240 WGBB.com, and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. We have a great show tonight. There's a buzz in town about the new dentist, and I wanted to have her on the show to find out what she's all about and why there's such a buzz. So I want to welcome Dr. Colleen Catera to the show.
Thank you so much. I'm happy to be here.
It's great to have you. So we were talking before the show. For the listeners know, she used to be on a radio station in college, so she'll sound better than I do on the radio tonight. She'll say less than I do. So before we get into things, tell us a little bit about where you grew up, where you went to dental school, a little bit about your background.
Sure. I actually am a native of Long Island. I grew up in Hicksville, and then I actually went to college at Skidmore College, upstate New York, Saratoga Springs, and then I attended University of Pennsylvania for dental school and graduated in 1996.
Very good. And then when did you come back to Long Island?
I actually came back to Long Island 4 months ago. I was working in Connecticut and really decided that I missed my family too much. Everybody is still located down here, and decided to look for a practice and have been here 4 months.
You know, it's kind of neat because usually when there's a new dentist in town, they're actually a new dentist, but you're a very seasoned, experienced dentist, so it's kind of a treat to have an experienced dentist be a new dentist in town.
Oh, thank you so much.
Tell me a little bit about, you told me a great story before the show about just sort of how you decided to be a dentist and some of what your earliest dental observations were. Maybe you could just tell the listeners about that.
Absolutely. I said I probably decided to be a dentist in utero. My mother had terrible teeth and was at the dentist constantly, and I was with her most of the time when she went to her dental appointments as a young child, middle school, and the dentist had such a great way of treating her that, I really admired him.
Kind of nice to have a role model even before you knew you wanted to be a dentist.
Absolutely.
So what attracted you to dentistry?
Well, I actually got a job dental assisting. I originally wanted to go to medical school. In high school, my senior year, got a job dental assisting, loved it. And my family dentist, who was my mom's dentist, was my mentor. And I just fell in love with the dentistry and wanted to pursue that career, and decided to, go to college, pursue a career in dentistry, and, that's where everything led me.
You know what's interesting? So many people, so many dentists that I've spoken to really decided to be a dentist very early on in life, junior high, high school. I don't think I've spoken to anyone that it was in college that they decided. It seems to be a calling people have earlier on. So that's kind of neat.
I agree.
Now, a lot of our listeners, I'm sure, were familiar with your predecessor, whose practice you took over, Dr. Ciminello, and he'd been in the community forever. He was a super well-respected dentist, a fantastic clinician. He must have put you through the ringer that he would trust you with his patients, because he loved his patients, and I know he wouldn't turn over their care to just anybody.
No, he threatened me, actually.
What did he say?
He said if I don't take good care of his patients, he's going to come back and get me.
Yeah, he meant it, though. I know he spoke to quite a few people before he finally, chose you to take over, because he really cared about his patients quite a bit.
Yes, and that was something that was important to me, too. I have the same philosophy as far as caring for my patients. And, it's a great location. He's a great person and did some phenomenal dentistry, has wonderful patients there, too.
Yeah. Something that interests me, I mean, you're a seasoned dentist, as was Dr. Ciminello, and two very good seasoned dentists can look at the same clinical situation and make a different decision about how they should treat it, because they each bring their own experience to the table. And I'm sure there are some, you would look at a tooth and maybe Dr. Ciminello would have treated it with a crown, and maybe you think, I can leave this tooth alone. And conversely, there were probably some teeth that Dr. Ciminello would have thought, I'm going to leave this tooth alone for a while, and you would look and say, I think we should treat this. And I would think being a dentist new to a practice and being introduced to patients who had such trust and confidence in their old dentist, how do you deal with that with patients when maybe there was a difference of opinion?
Well, obviously, it can be a challenge because Dr. Ciminello was working with these people for, 35, almost 40 years. However, we have a lot of new technology in the office. We have digital x-rays, and we have an intraoral camera. So we actually take photos of the teeth, of all of the teeth, but the teeth we're concerned about, we can put them right on the computer screen and show the patient exactly what concerns we have, and it helps them, to understand what's going on in their mouth.
So they can really see what you're seeing. I mean, you'll describe it to them, but you help them realize why it's necessary.
Exactly.
Help them see that. And I know you were telling me also that there's a lot of really new technology in terms of dental restorations that you've introduced to patients, and that it's really, while amalgam was great, these new materials are far superior. And maybe tell our listeners a little bit about what the difference is and why this new generation is better.
Sure, absolutely. Well, the amalgam restorations have been around for a very long time. However, a lot of tooth structure has to be removed in order to get the amalgam restoration to stay in the tooth.
The amalgam is the silver restoration, just so for our listeners who don't know.
Yes, okay. Absolutely. So with the silver fillings, a lot more tooth structure had to be removed. And with the expansion of the amalgam restoration, it can lead to tooth fracture also. Now we have composite restorations, which are basically as good as, if not better, than the amalgam silver restorations. We have to remove a lot less tooth structure, which is always good. We're conserving tooth structure. And with the new bonding agents we have, there's minimal to no sensitivity.
Wow.
After the restoration.
So these new restorations actually make the tooth stronger than it was when it had the amalgam restoration in it.
Absolutely.
Wow. How do they hold up?
They're holding up very well. I've been doing the composite restorations for the past 10 years, and they're always coming out with newer materials, improving things, and I find that they are, holding up just as well as the amalgams.
That's exciting. I know you were telling me before the show also that you've put some neat technology in the office that Dr. Ciminello didn't have, and maybe tell our listeners about that as well.
Yes, absolutely. The biggest thing that I'm very excited about, we have digital x-rays, which actually has reduced the radiation exposure by about a third of the traditional films. And also, we're able to see the image immediately. We can blow up the image, and we can actually change the contrast so we can really diagnose better and also educate the patients. Also, we have an intraoral camera, which as well is allowing me to see more things with the tooth than I could see just visually, because we can blow up the image.
What do patients say when they see their x-ray come up on the screen as opposed to having to see that tiny little film?
They're in shock, and they don't necessarily want to see what is going on in their mouth, but it is a good education for them, and we're helping them to understand really, what's going on in their mouth.
I think that's a nice thing because, well, for a few reasons. First, you can be green. You don't have the chemicals anymore either.
Absolutely.
And all that waste, the lead and this and that. But, years ago, patients who were, maybe in their 60s and 70s, whatever the dentist, they were just a more accepting cohort, if you will. But now we all have a healthy skepticism, and it really is healthy. There's nothing wrong with asking your doctor or a dentist for their justification for what they're doing and wanting an explanation. So I think it's nice that you put that tool in so patients, you're proactive. You tell them about it and you show them so they almost don't have to be in the position of asking, but you help them understand.
Exactly, and they're very excited that we have this new technology in the office, especially when they hear a lot of people are concerned about radiation exposure, and when they hear that there's, a lot less radiation, they're very happy about that.
Mm-hmm. Tell me who's the typical patient in your practice that comes in?
Typical patient, we have a lot of families, working class patients. A lot of patients have been with Dr. Ciminello for many, many years, so we have multi-generations of families. And I'm very fortunate that, almost every single patient has stayed with me in the transition.
What's the reaction like after they have a visit with you?
They're actually very impressed, and they feel very comfortable, which is great because they always tell me I have very big shoes to fill, following Dr. Ciminello. But they've been very happy.
When I heard he was retiring, in my own mind, I said, who could ever take over his practice? First, he was a great dentist, and he was such a nice person. He really cared about his patients. And, to your credit, he selected you because they are big shoes, and there is a buzz around town, and everyone's talking. So it's great that you can do that. I give you a lot of credit.
Thank you.
Let's talk a little, you've been a dentist a long time, and you've seen a lot of dentistry, and I'm sure there are people listening on the radio today who haven't been to the dentist in a long time, maybe 5 years, 10 years, 20 years, 30 years. What do you think are some of the biggest barriers that keep people from coming to the dentist?
Well, there's a few barriers. I think one big thing is cost. And I think as far as that is concerned, in my office, we actually offer payment plans. We do participate with a lot of the insurances, but for those patients who exceed their insurance maximum or don't have insurance, we offer care credit, which is a great way to extend the payments over time. And we also offer in-house financing.
So let's talk about cost for a minute. What's the best way for someone to reduce their dental expenditures over time? See, I think most people think if they stay away from the dentist, they won't spend money at the dentist, but it's really just the opposite, isn't it?
Yes, they do. Prevention is actually the best way to keep the dental costs down, because people have the misconception if they wait and they don't go, nothing, is happening. However, if they don't visit the dentist over, say, 5-10 year period, a lot of things can be going on. They could have gum disease. They could have broken down fillings, decay, teeth maybe that need to be extracted. And now it's a bigger expense than if they had, gone regularly. And we could catch things early.
It's like a car. You have to do a little maintenance on the car and it lasts a lot longer. It's a shame that people tend to stay away like that. And I'm always sort of amazed when people maybe don't go to the dentist because of the cost of a cleaning or a regular visit. But when you think what people spend maybe on their cell phone every month, their iPhone or their a cable TV package or those kinds of things, or going out with some friends. Yeah, it's really a pretty small investment, compared to the payoff in the other end.
It is, and teeth are such an important part of a person.
Yeah.
So,
but it isn't cost for everybody. I mean, I'm sure there are other reasons why people stay away. So, what else have you seen?
I think fear is another huge reason that prevents people from coming, and it's something that a lot of people have had bad experiences, either when they were children or as adults, and that stays with them. They have a hard time overcoming that fear. Dr. Ciminello was phenomenal, with relaxing the patients, joking with the patients. And I also, am able to make the patients feel comfortable. I listen to them. I tell them to let me know if something is bothering them. And we do our absolute best to make the patient comfortable and have a pleasant experience in the office.
Do you think some patients, in addition to the fear of just the fear of the, pain, they're really uncomfortable with the fear of maybe being judged if they haven't been to the dentist, and then that keeps them away longer? Have you run into that?
Absolutely. I think a lot of people think they're the only one with that problem, that their teeth are the worst teeth, that I've ever seen, and it's not that case. And we never judge anybody. It's something that, people have different circumstances for why they haven't been to the dentist or neglected their teeth, and I'm here to actually help the patient get back to health.
So let's talk about that process. Let's say somebody's listening now, they call up, they want to come to your office, they haven't been to the dentist in a long time. Take me through the process of that first phone call through, having their teeth brought back to good health.
Well, when they first call, they'll actually be speaking to my office manager, Doreen, or Dory as she goes by, and she's wonderful. She will schedule the appointment and give them information, and when they first come in, we will review the patient's health history, do a thorough extraoral and intraoral exam, basically checking the outside and the inside of the mouth, do whatever x-rays are necessary, usually a full set of x-rays, so we're taking every tooth, different angles, and we also check their fillings to see what condition they're in, see if they have any active decay, any new cavities, and we do a full periodontal exam, so we're checking their gums for any gum disease. As well, we take intraoral photos, and then we kind of give the patient an overview of what's going on.
You were telling me before the show that part of the new patient intake is just kind of sitting and chatting with the patient.
Yes, absolutely. We want to find out what motivated the patient to come into the office, especially if it had been many years since their last visit. I'd like to know, are they in pain? Are they unhappy with the way their teeth are looking? What is it that they're looking to get out of their dental treatment?
Mm-hmm. And when you talk to the patient about their needs, do you usually do it at that first visit? Do you have them back for a second visit? How do you handle that?
I actually have them come back for a consultation. That way we sit, in my office in a different setting, a more relaxed setting, because patients are always very nervous to be in that chair. and then we discuss, what concerns I have, what concerns they have, and then we come up with a treatment plan together.
Do you encourage people to bring their spouse or a friend or something like that to those visits?
Absolutely. If they'd like to bring a family member, spouse, children, parents, that's fine.
And do patients typically have options when they have problems how to restore things?
They do, absolutely. I try to give them a number of options, that will work for both of us. And then, some things there may not be, a number of options, but it's something that we definitely want to give them, different possibilities so they have a say in their treatment.
We're going to take a fast break. When we come back, we're going to keep talking about maybe some of the barriers that keep people away from dentistry. I'm Dr. David Scharf. You're listening to Healthy Living Radio on WGBB.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back. We're talking with Dr. Colleen Catera, the hottest dentist in the South Shore now. Everybody's talking about the revitalization of Dr. Ciminello's practice. We're lucky to have her on the show. So before the break, we were talking about some of the barriers that keep people away from dentistry, and they're kind of universal. I would assume when you're in Connecticut or on Long Island, it's all the same. We spoke a little bit about fear. We spoke a little bit about cost. What are some of the other things that keep people away?
I think time is a big thing, especially nowadays. People have such crazy schedules in their life between work, children, different activities. So at my office, we actually have evening hours 2 days a week, and I also have the office open every other Saturday to accommodate the patients.
So really working, not working, whatever it is, there's someone can come into the office.
Absolutely.
Yeah. And what else have you seen? What other kind of reasons do people put off their dentistry?
I think also lack of urgency. Patients, if something doesn't hurt, they don't necessarily feel that they have a problem. However, if we, work in the preventive area of dentistry, that actually is going to be better for them in the long run. So if they have a very small cavity, better to take care of it now versus waiting a few years and now maybe they need a root canal where they need to lose the tooth.
Isn't it funny how people who are very preventive oriented in other parts of their life aren't sometimes that way with dentistry? I mean, nobody waits till their car doesn't stop to get the brakes done.
That's very true.
The mechanic tells them the brakes are wearing thin and they get the brakes done. And, people tend to change their oil because they realize the value. But why do you think people still have trained in their mind that I guess if my mouth doesn't hurt, it's okay?
I think, again, it's that misconception that, maybe we're trying to, sell them something, which, I'm definitely out for the patient's best interest. And I think really, some people just feel if something is not bothering them, then, they don't have any symptoms. They don't see that there's a problem. That's where I think it's really important to educate the patient. And especially with all the new technology I have in the office, it's really easy for the patients to understand what we're seeing.
I would guess between the digital x-rays on the screen and the camera, you said most people could just look and say, hey, there's something wrong there. That there shouldn't be a crack or there shouldn't be that dark shadow.
Exactly.
That's a nice tool. And what else? Any other reasons why people stay away that you've seen?
I think lack of trust also, which we, touched upon a little bit before. Patients feel that maybe what another dentist told them wasn't accurate. And, it takes time to build up that trust with the dentist.
I think the insurance companies do patients a disservice because, I often joke that people spend more time choosing who's going to cut their hair than who's going to be their dentist. And so people's insurance changes and they change dentists, but they never set down roots. Like one of the things I thought was pretty neat about Dr. Ciminello's practice was, like you said, he'd had patients that were there for, 2 and 3 generations, and they set down roots so that they established a trusting relationship. And when people change dentists every couple of years because their insurance changes, they never get to experience that level of trust with a dentist.
Exactly. And I think it also prevents the patient from really getting comfortable with somebody. Dentistry, it's a very intimate thing between the dentist and the patient. We're right very close to them and looking in their mouth. And, a lot of patients don't feel comfortable with that. But I think that, if they can stay consistent with the same dentist, they will feel more comfortable.
What kind of changes do you see in people, maybe who've let their mouth go to disrepair and then they come in, they get their teeth, fixed? How do the people change?
It absolutely changes their life.
Yeah.
I've seen them, just become more outgoing, more self-confident, smiling more, have a full makeover where they, get their hair done and, change their hairstyle, buy a new wardrobe. I think it really gives patients confidence.
So it really is like they have on TV on those shows where people blossom, they get their teeth fixed.
Yes, absolutely.
That's got to be very satisfying, I would think, to be able to do that.
It is. It is. I absolutely had a patient in Connecticut who was a cancer survivor and was very self-conscious about her teeth. She had, some issues because of some cancer, chemo treatments. And we actually redid her whole mouth. She had some gum surgery, redid all of her crowns, and she actually was able to get implants. She had a partial she was very uncomfortable with, and it totally changed her life.
What do people say to you like that? I mean, I would assume it's got to be a very emotional thing when you finish those cases.
She cried, and she brought me a huge bouquet of flowers and, said she would be grateful to me forever because I gave her smile back.
You really did. Everything you read when people, about the first impression that people make, it's always their smile, everything you see. Have you seen a lot of people with the economy sort of being down, realizing that, I'm unemployed, my smile doesn't look good, I really want to get this looking better to give them a competitive edge in the marketplace?
Absolutely. And I think, employers are looking at that. Appearance is very important. And I think if people have, a nice smile, that will give them an edge over, possibly somebody else. So it is really important for them to, keep up with their dental hygiene and keep their teeth in good condition.
It's kind of funny, you'd think that's just the time to cut back, but really if you want to lower your expenditures, you have to keep with it.
Absolutely.
You have to keep with it. So what are your plans for the practice? What are your plans going forward in the next couple of years? I know you have big plans, so I want you to tell everybody.
Well, we're actually doing some renovations in the office as we speak, just updating some of the equipment, and also we're redoing the waiting area, painting some of the operatories. And I'm planning, on expanding and bringing a hygienist in full time and possibly an associate dentist, in as well. So
spruce things up and onward and upward.
Absolutely.
You were also telling me before the show that you like doing a lot of cosmetic dentistry. So let's talk a little bit about that. I mean, people hear that all the time, smile makeover, cosmetic dentistry. What does that really mean? Well,
it could involve a number of things, but I really do enjoy doing porcelain veneers, porcelain crowns, and it's something that, if a patient is interested in doing some cosmetic dentistry, I have them come in, we sit down and talk. We actually take some study models, some molds of their mouth, so we can actually work with the lab and achieve what they're looking for, whether it be whiter teeth, straighter teeth, longer teeth, but just to give them the smile that they're really looking for.
How do you approach that with a patient? I would assume you have to be very delicate because you don't, someone may love their smile. You may think you could really improve it quite a bit. So how do you let them know maybe what's available without saying, hey, Mrs. Smith, did you ever think of fixing that black tooth in the front of your mouth?
Sure. Well, I always ask the patients, what things about their mouth concern them. And I also let them know that we do offer whitening and we do cosmetic procedures. And that a lot of times will lead into, them asking questions and letting me know what is their concern.
And are the people that do cosmetic procedures, sort of the average Joe, or are they, your wealthiest of patients? Who has those type of procedures?
Actually, everybody does. And it's just, I guess, whether the patient is really interested in doing that and, whether it's something that they really desire. But anybody can have cosmetic dentistry, not just the wealthiest people. We can make it affordable for everybody. Mm-hmm. So
what typically brings people in? Is it, their child's getting married or, some big event that they finally want to spruce up their smile? How do those come about?
It usually is a big event.
Yeah.
I've seen, people coming in prior to a wedding, their daughter's getting married. They have to, walk them down the aisle. Their son is graduating from college. Their 50th anniversary is coming up. A lot of big events in people's lives are what bring them in.
They sort of take stock and say, this isn't quite how I want it to be.
Yes, absolutely.
Who's the oldest patient you ever did cosmetic dentistry for?
The oldest patient would have to be about 97 years old.
Is that right?
Yes.
How did that come about?
She actually had a denture, and she was not happy with the appearance of it. And she said she wanted her teeth to look whiter, and she had a new denture made. So,
And how long had she been with that old denture?
I believe about 15 years.
Wow.
So it was very worn down, very stained and, yellowed. So she was definitely looking for something to give her a boost.
She must have looked 92 by the time you finished with her.
She actually looked 82 afterwards.
That's nice. Do you find that people, after they finally have cosmetic dentistry, sort of kick themselves for waiting for so long to fix the problem?
Yes, they do. They, after they go through the experience and they see how their teeth look and what a big difference it is, they do wish that they had done it sooner.
Why do you think they wait?
I think cost is a big thing, and I think also, the fear factor. They, are concerned it's going to hurt, but I think cost is a big thing.
Do you think that they wait anticipating that the cost is going to be different than what it actually is, or are they waiting based on that they checked into it, this was the cost, and they want to wait?
I think it's on both ends. And I think sometimes people are very surprised. They think it's going to be a lot more expensive than, what the fees actually are.
So for somebody listening that's been thinking about doing, touching up their smile, a big touch up, a little touch up, what would your advice to them be?
I would say call our office for an appointment, and I would be happy to do a consultation for them and see what's the best way to improve their smile.
And it sounds like there's multiple ways. It's not just, porcelain laminate or...
No.
There's many ways to improve it.
We can do whitening, we can do bonding, we can do crowns, porcelain veneers. So there's a lot of different options out there for the patient.
You mentioned whitening, and you see whitening all over the place now. There's whitening places in the mall. You can buy whitening strips in the drugstore. Tell our listeners maybe what's the advantage to them of having their whitening done by a dentist as opposed to, say, in the mall or just buying a white strip.
Well, I think that going to the dentist, we're actually using materials that are approved by the American Dental Association, so we know that they're safe. When you go to a mall or, buy something from an infomercial, you never know exactly what you're getting, and it's not being controlled by your dentist. And there may be factors that would create problems, and maybe whitening is not the best option for the patient. So then the dentist, we can actually evaluate the patient, make sure that's the right treatment, and we have, different strengths of the peroxide gel that we usually use in the trays. That, maybe somebody has very sensitive teeth, we might want to give them a lower concentration so they don't have too much sensitivity post-op.
Do you have people that come in that have had whitening done, say, with strips, and they were disappointed in the result?
Yes.
Because it really wasn't the right treatment for their problem?
Yes, absolutely. And I always tell patients when they ask about that, it will give them a little bit of a result, but if they want to get a dramatic result, they really want significantly whiter teeth, that, the whitening we do in the office is the way to go.
What do people say after they get a whitening? They must love that as well.
Oh, they do. And I have actually had patients who have quit smoking after doing the whitening. Because they're so happy with the results.
I would imagine it's nice to get sort of a quick fix, as opposed to have a lot of visits or whatever, just improve things and kind of be on your way.
Yes, absolutely.
And, almost now, white is the new normal. So many people have lightened their teeth or done cosmetic dentistry. It's almost like if you have normal-looking teeth, they're darker than everyone else's.
That's very true. All you have to do is, look at everybody on TV, open a magazine, and, everybody has very white teeth. So,
yeah, I would imagine that's a challenge, though, to, when someone comes in and they say, I want white, beautiful teeth, but in your heart, that won't look nice in that patient's mouth. You sort of need to talk them down from a result that they won't be happy with. Well,
I think we have to have a dialogue with the patients and explain, what things that we're seeing and why maybe it's not the best treatment. And that's with anything in dentistry. So
Very good. So in our last couple of seconds, what would your final words be maybe to someone who's been away from the dentist for a long time, sitting on the fence, listen to the radio show and thinking, maybe I should, maybe I shouldn't?
I would say absolutely now is the time. You don't want to wait any longer, because the longer you put off seeing the dentist, it could be, worse. So I would, definitely tell anybody to call my office.
And how can our listeners get in touch with you? Tell us where you're located, your phone number, your website.
Sure. We're actually located in West Babylon, 393 Sunrise Highway, Suite 3, Long Island Medical Associates Building. And the phone number is 631-422-6901.
And do you have a website?
Yes, it's www.dentistbabylon.com. It's in the process of being updated, but we're working on it.
That's easy enough to remember. Well, yes. I can see why everyone in town is so excited. I mean, you're a real dynamo. You have, I give you a lot of credit just for Dr. Ciminello having selected you to care for his patients. I'm so happy you're on the show tonight. I really want to thank you for being with us.
Thank you for having me. I really appreciate it.
My pleasure. We'll be back next Thursday night with another episode of Healthy Living Radio. Thanks for listening.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.